Good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled The Potential of Yoga to Impact the Health of Black Women. Today's webinar is the third in the Spring 2020 webinar series offered by the Council Solutions to Diabetes in Black Americans Core. This core is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field of diabetes and research in Black Americans. We really appreciate you joining us today. My name is Tiffany Eaton. I'm a doctoral candidate and research assistant at the Dornsife School of Public Health at Drexel University, where the council is based, currently working with Dr. Shariki Kumanyika, the founding chair of the council. I will be your moderator today. The council's mission is to develop and promote solutions that achieve healthy Black communities. We leverage the credibility and perspectives of Black American researchers, other collaborators, and research partners to facilitate relevant, community-engaged, actionable strategies that positively impact Black communities. Today's session will discuss yoga, which can be an effective strategy to address adverse health outcomes by decreasing sedentary behavior and stress. However, little research has been conducted to study its effect in African American women. We will hear a review of the existing literature on the benefits of yoga and an exploration of its potential to address health outcomes in Black women. During the presentation, we ask that you post questions using the Q&A button in the Zoom webinar interface. We will review and select questions for our presenter to respond to after the presentation. If your question was not selected for response, we will share follow-up feedback after today's session. Please feel free to also use the chat window to interact with fellow attendees during the session this afternoon. Today's presentation will be recorded and archived for future viewing. We will publish the webinar online and share the link via email. Our esteemed speaker today is Dr. Dahia Barr-Anderson. Dr. Barr-Anderson is an associate professor in the School of Kinesiology at the University of Minnesota and the director of the Behavioral Physical Activity Lab. Her research interests focus on physical activity, sedentary behaviors, and obesity prevention in children and adolescents. She is particularly interested in home and community-based environmental interventions that incorporate both physical activity and nutrition to achieve healthy outcomes and to decrease racial and ethnic health inequalities. In alignment with her personal love for yoga, she also explores yoga as a strategy to address cardiovascular risk factors in African American women. Dr. Barr-Anderson, I now invite you to proceed.
Thank you so very much, Tiffany. I appreciate the introduction and thanks for all of your assistance over the past couple of weeks getting this all set up. And a thank you to Shariki for inviting me to be a part of the webinar series. I really appreciate it. And I'm super excited to be able to share some of the work that I'm currently focusing on. And of course, a big thanks to the Council on Black Health, which continues to evolve and contribute significantly to better understanding the health of Black people in the US. And so today I'm going to present on the potential of the potential of yoga to impact the health of Black women. I did, you might have noticed that the title has changed a little bit, that the information sent out, all of it had African American women as the terminology used, but I decided to change it to be more inclusive. And so you'll see that change throughout all of my slides and when I'm referencing throughout the webinar. Okay. And so in terms of the outline of what we're going to do today, we're going to do a slightly different introduction. I think with all that is going on at this current time, this topic of yoga is just so timely with COVID-19 and the global pandemic that many of you may have started engaging in some type of yoga or deep breathing to try to help to focus and to address some of the mental and emotional and even physical anguish that many of us are enduring at this time. So we're going to start with just a little bit of yoga, of focusing on some of the breath work, which is an important tenet of yoga. And then I'll go over a brief overview of the health of Black women. Then why yoga? Why are we focusing on yoga and how could we potentially use yoga to address the health of Black women, the overview of yoga research, the current literature, what's been done in terms of interventions for Black women, yoga interventions in Black women, and then going into future directions. So let's get started and let's really quiet our minds. I can imagine that each of you are seated at your desk. You're having probably spent a lot of time over the past couple of months hunched over the same desk, the same space, working, telecommuting. And so let's start this session with just a little bit of yoga. So if you could please entertain me and just follow along with some of the instructions that I am going to give, I'll greatly appreciate it. So sit up really tall, wherever you are, sit up nice and tall, really straighten your spine, relax your shoulders, and then gently close your eyes. You don't have to do anything differently to begin with for your breathing, but start to roll out your shoulders. Roll your shoulders back, nice and slow. Not focusing on your breath yet, and just any tension or anxiety that you may be experiencing this morning to get to this place right here to listen to me talk about yoga, just let it all go. And then let's change the direction of your shoulders. Roll them forward, nice and slow. Being very intentional with your movement. Right, we're often inundated with activities, things to do, a long to-do list, and sometimes we're on autopilot. So allow this movement to be very intentional. And then relax your shoulders, plant your palms on your thighs, facing down to conserve some energy. And then pay attention to your spine. Go back to the lengthening of your spine. Take your abs and pull them in nice and tight to support your low back. And then just sigh out any air in your lungs. And then take a slow inhale through your nose. Continue to sit up even taller as you do so. And then exhale through your mouth. Let it all go. Continue with this breath. Inhale for 4, 3, 2, and hold it at the very top for 1. Hold it. Just be still. And then slowly exhale through your mouth for 4, 3, 2, 1. We'll do one more breath just like that. Inhale slowly for 4. Sip in more air. 3, 2, and hold it at the top. And then release the air through your mouth for 4, 3, 2, 1. Continue with that slow breathing. Nice slow inhales and exhales. And as you do so, take your right ear and lean it towards your right shoulder, just gently. I feel the stretch in the left side of your neck. Try to release any tension that you may be holding in your neck. And then bring your head back to center and release your left ear towards your left shoulder. You don't have to force anything. Just let gravity do what it does. Let it work. But feel that gentle stretch in the right side of your neck. As you inhale, bring your head back to center. Sit up even taller, relax your shoulders, re-engage your abdominal muscles to support your low back. And then one more breath together. You inhale and exhale. Blink your eyes open and yay. So hopefully just a little bit of yoga. Hopefully you feel a little bit more relaxed, more centered, a bit more focused, and let's get started to talk about what I came here to talk about. And so we're going to start with focusing, on looking at the health of Black women. So I feel that we are pretty familiar, many of us, actually, I don't want to make any assumptions, that many of us on this webinar, that we're familiar with the not so pleasant picture that is sometimes painted when discussing the health of Black women. I mean, Black women are strong, spiritual, resilient beings, but many times we experience a less physically active lifestyle. We report high levels of chronic stress. A lot of times that stress is related to occupation, our daily life, the racial impact of this US society. Over 80% of Black women have a high weight and were considered overweight or obese. We also report high rates of high blood pressure, as almost 50% of Black women are hypertensive. Right? We know there's work to be done when examining the health of Black women, and we've learned some really key pieces of information over the years in understanding Black women's health. And the basis of studying many of this information has been from learning about many of the things that we've learned about Black women's health has come from weight loss trials. And so, excuse me, two of the earlier studies that have included, oh, I'm sorry, wait a minute. Sorry, my slides are, oh, here we go, sorry. I gotta get used to not seeing people interacting and then just going on. So sorry about that, about this little glitch that I just did. So getting back to what we know about some of the earlier studies that focus on Black women's health have been weight loss trials. And so two of the earlier studies that included a significant sample of Black women, so we can learn more about their health, was the hypertension prevention trial and then the trial of hypertension prevention, which were multi-center studies funded by NHLBI conducted in the 1980s. And these trials, they focus on controlling blood pressure in order to improve the health of their participants. And the way that they did it was mainly through diet, along with stress management, which was particularly true for the trial of hypertension prevention, so for TOHP for that trial. And you can see from the table in terms of looking at baseline and the follow-up data. And what I really want to focus on related to these studies that really is connected to understanding Black women's health a bit more is that there are minimal changes in weight for both groups, but starkly less weight loss for Black women compared to white women. And so from these studies, one thing that we learned early on in terms of focusing on Black women's health that we continue to implement throughout the work currently is that these studies were one of the, or some of the first to see that the same intervention did not yield the same results for Black women and for white women. So there was something going on in terms of seeing these different racial ethnic differences in terms of the effectiveness of the intervention. And so the lives of, Black women, or any ethnic racial population is really shaped and lived differently from that of the majority of a white population. And those different experiences can help to shape habits and patterns around behaviors such as physical activity and eating, and thus weight control, right? So factors that contribute to health. And so piggybacking off of the previous slide, that when examining the literature related to interventions for Blacks, we found that when offered the same intervention, Black participants tend to lose less weight than white participants. And that although, there are all these other factors that come into play, it could be motivation, adherence, when you're focusing on behavioral change, that one thing that seems to be pretty evident and pretty clear is that culturally appropriate interventions unique to Black customs may be more effective than broader, more general interventions when it comes to behavioral change in this population. And we're kind of familiar that it's common for interventions that are targeting Black people or any ethnic, racial minority to integrate some level of cultural appropriateness or cultural tailoring. And what we usually see is kind of surface level, where you may see the same race intervention strategist. The program may be held in the Black community or in a space that is familiar to the participants. And also you may see that it's surface level in terms of making sure that the activities that are being offered are those that the participants are truly interested in and what they really want to do. And so you see those kind of on the surface level adaptations, but we don't always see like these deeper structural adaptations. So thinking of the Black core values, our customs, who we are as a people, and those norms and values that really define our culture. You don't always see that incorporation of the core cultural values, the shared history, social norms, beliefs, and behaviors. And so, right, I bring this up because it's really important, particularly later on once I start talking about the various yoga research that has been done and where I would like to see the field go, that is really pertinent that we stay cognizant of the importance of making things culturally appropriate and tailoring the future interventions so that they better fit the norms, beliefs, values of Black women. If we truly want to be able to make long-lasting, sustainable changes in this population. And so more recent interventions that have focused on improving Black women's health, they've targeted a lot of them physical activity or combination of physical activity and diet as a way to address high weight in this population. So going from that perspective, various physical activity has been incorporated or have been incorporated, such as walking and dance, aerobic exercise, resistance training. Those tend to be the most common. Melissa Whitglover did a nice review paper that examined some of those interventions that were targeting physical activity. And there were some promising results with between group and within group differences in improving physical activity. But by far, it was really popular in terms of like the walking as some of the more prevalent strategies used to change the behavior in these studies. And so I want to focus a bit on these walking interventions. So, right, walking programs, they were the most utilized of the interventions, and it makes sense, right? They are easy to implement, require minimum equipment, and is usually a safe and acceptable strategy for high-risk populations. So thinking about those who may be sedentary, just not very physically active. And so, right, even though it's easy to do and has been successful in the past, there's been focus groups that have reported coming from Black women who have engaged in walking interventions that the repetitiveness and monotony of walking programs or traditional exercise interventions, right, it can have an effect on motivation, or it can also be physically challenging related to like musculoskeletal issues due to kind of the repetitive weight-bearing exercise that you get when you do walking, right? It's easy to do, but there are some issues related to implementing or engaging populations in this type of intervention. And so I say all of this to come back to the point of, although there's been work done in this area of focusing on improving Black women's health through activity and movement, and some of them have been, have made some nice strides in terms of affecting some type of behavioral change, there is room for the possibility to explore additional avenues of activity that could be just as effective or even more effective to positively impact the health of Black women. And so this brings me to yoga. So anyone who knows me, and there's probably a lot of people in the webinar who don't know me, but anyone who knows me knows the passion that I have and the love that I have, and part of the my identity is greatly tied to being a yoga practitioner. I was brought to yoga because I was a former dancer and cheerleader, and I always enjoyed stretching. And so I saw this as a way to continue to stretch and be flexible as I got older. But the more I got into my yoga practice, the more I realized there's kind of less than talked about benefits related to having a regular yoga practice. And so the work that I'm about to get into and really talk to you about, it really stemmed from totally from a personal standpoint is how it all got started, because I was experiencing these major shifts in my health, both from a mental, emotional, physical standpoint that I credited to yoga. And I was trying to bring friends and other Black women in my life to yoga, and some of them were really hesitant. And so it made me want to think about how could I go about really exploring whether or not this type of exercise that has brought so many benefits to my life could help to address some of the health outcomes that we see, and particularly in Black women. And so, yoga, we hear a lot about it, particularly now during this global pandemic. And the slide shows just, a wide range of benefits of yoga, doing current literature searches of studies that have been able to impact physical and health and psychological outcomes via yoga. And so, well, you can't assume that everyone understands and knows what yoga is all about. Sometimes I was actually just reading an article last night, and it was an article by a yogi in Atlanta, and she wrote a blog about, and it was titled Yoga for the Black Christian. And so it makes me think about, for some people, they think yoga is a type of religion or it conflicts with their own religion. But the practice itself is really one that is rooted in connecting the mind, the body, and the breath. And so, on a more kind of societal level, it's been pinpointed as one of the hot fitness trends. So for the past decade, American College of Sports Medicine has produced a list of hot fitness trends, and yoga has been listed repeatedly as an emerging activity for folks to an emerging activity that is growing in popularity and could potentially have some health outcomes, some health improvement outcomes associated with it. The word itself is rooted in yuj, so it's to join together, to yoke, to unite. I won't get into like the yoga philosophy, but if you dig deeper into yoga philosophy, right, the core purpose of yoga is for us to be one and united. And so that's where that root comes from. There's three main tenets of yoga: the breathing exercises, physical poses, and meditation. So what we did at the very beginning, we really focused on the pranayama, or the breathing exercises. And because we were still, in terms of not moving, very intentional, we did tap into the meditation piece just a smidgen during our first exercise. And so it's a well-established Eastern practice that's been promoted as safe and effective way to encourage less sedentary behavior, improve strength, balance, flexibility. It can decrease depression and stress. You know, one of the enticing features of yoga is that it's a minimal equipment activity. It can be practiced almost anywhere, different intensities, and hopefully can be used to decrease inactivity. So thinking about like how it parallels to potentially a walking intervention in terms of how easy it can be and where it can be done almost anywhere. And there are just many different types of yoga, yoga that's available nowadays. This is a slide, oops, I went too far. That kind of shows some of the popular yoga that you can find. Hot yoga, gentle yoga, more restorative yoga, power yoga, flow yoga. So lots of different options for individuals to engage in. But all of them are rooted in those three tenets of yoga, with the breath, the movement, and the meditation. But when we often think of yoga, we think that a certain person or a certain type of person engages in yoga. And for the average Western yoga, right, it is, he or she is more likely to be female, younger, non-Hispanic, white, college educated, higher earners, and better health status. So, and so I always add this slide because there's kind of a rhetoric when it comes to yoga that is not for everyone, that there's only certain people who do yoga. And we, you know, like we always do for all types of stereotypes, society still wants to hold on to that stereotype. But that really is not the case. The landscape of who's doing yoga, where they're doing it, and so forth is really changing. And so in particular, I wasn't able to add any pictures because I didn't have the copyright to the pictures that I wanted to add that really would have depicted what I want to show on this slide. But if you were to scour the internet, you can easily find photos of people, different skin tones, of various racial and ethnic backgrounds, different body shapes, different abilities and disabilities, different ages from the youngest child to the oldest senior adult engaging in yoga. And so, right, the Western yogi, that image of the Western yogi is what I showed in the previous slide, right? That's what people tend to think about. But in actuality, that landscape has changed, and it really is for everyone and becoming more accessible and acceptable to more populations. And so in terms of, you know, the more, the numbers related to who's doing yoga, there's about 31 million Americans who've ever practiced yoga, and 21 million have practiced in the past year. And many of them have been brought to yoga because it was a recommendation from their healthcare provider. It was seen as a safe and effective way to promote physical activity, and then for them to be able to focus on strength, balance, flexibility, and particularly among those who've been suffering from hypertension, heart disease, joint aches and pains, depression, and stress. So a potentially low impact activity that could reap a lot of benefits. When looking at the numbers even more in terms of the prevalence by race, white, Hispanic, and Black, you'll see that of those who have never done it versus ever versus the past year, that even though whites in the US are more likely to have engaged in yoga, that there is a nice segment of racial and ethnic minorities who are also engaging in yoga. So there is the possibility of being able to use this type of physical activity to influence the health of Black women. And you'll also see that there has been an increasing popularity among Black people when it comes to yoga. There's been the growth of Afrocentric yoga. So there's Kemetic yoga, which is like an ancient Egyptian system of yoga. And it is based upon the principles of physical movements combined with like the breathing and meditation. So what you usually see in any type of yoga, but it really is rooted in like ancient African history. And so, and even the poses that are a part of the practice, they kind of mimic Egyptian hieroglyphics. But there's been a huge growth in Kemetic yoga. And then there's also, you see more Afro flow yoga, and it really is focusing on the healing, balance, and peace of all humanity, but with a focus on those of us from the African, I shouldn't say those of us from, but rooted in the history and the practices of like yoga, dance, rhythm, spirituality, and cultural values that's kind of rooted in the African diaspora. So you see the growth of these yogas, so making yoga more appealing to non-white populations in at least the Western world. And then there's also been the establishment of Black yoga organizations. So, you know, with the growth of yoga, there's been a growth of yoga instructors and trying to find a community where the instructors can come together and kind of offer more of an institutionalized voice to the broader yoga community representing Black and brown people. And so you have the International Black Yoga Teachers Association, which is kind of defunct, but has led to the Black Yoga Teacher Association, which is live and well. And then yoga as a peace practice, which really focuses on addressing trauma within marginalized communities and using yoga to do so. And so, you know, also you see the expansion of social media presence of Black yoga practitioners. So any quick search, you can find a plethora of representation, kind of going further that yoga is truly for everyone, that it's not the same as what it has been depicted in the past. But we have found, right, so it's becoming more popular, and that particularly Black women, they do engage in more mainstream yoga classes, or you do see Black women engaging in mainstream, and by mainstream I mean majority white yoga classes, but they don't always continue. There's some research out there that has been published that they don't always continue, partly due to maybe the unfamiliar spiritual aspects of yoga. So going back to what I said earlier about the book or the blog I was reading last night about yoga for Black Christians, that there's that unexpected, unfamiliar aspect of yoga, whether it's related to the chanting that you can often hear, the use of Sanskrit. So, you know, instead of English, which can kind of make it even more mystical in terms of yoga. And there's sometimes the religious sounding music that you'll hear that can stimulate some preconceived notions about what yoga is and how it could potentially conflict with your spirituality. And then also, it's been documented, and I see, Tiffany, I will need to maybe give these, I can't give you slides again, but I see that you can't see the reference for this slide. But what was also has been documented is that there's that lack of inclusivity. So the lack of representation of full body or of yogis of color. And so, and then additionally the costs. If you are a yogi and you go to a traditional yoga studio, like the place where I practice, it's expensive. I teach there, so I don't have to pay, but the average customer pays about $150 a month to practice. But there's a lot that you can do outside of the home if you just have the right resources. Or inside the home, pardon me, inside the home. And so what we do see, right, so there's the possibility, right, of women, Black women particularly, engaging in yoga. And so started looking to see what has been done in the literature related to research for yoga. And so it's growing in popularity just like the activity itself. But what you do find that many of them are, are based in India, and many of them are, the majority of those, the remaining ones that aren't based in India, really focus on white populations, and that there's minimal studies that focus on minority populations in the Western world, and particularly African or Black women, pardon me. And so from the literature that is out there though, it's really clear that there is, there's promise for yoga being used and is related to being able to see positive impacts on psychological symptoms and disorders, pain symptoms, autoimmune conditions, immune conditions, pregnancy, weight loss. So the list can kind of, it really is very promising to see what is going on in terms of the yoga literature. But it's, and with the strongest evidence really related to cardiovascular risk reduction and mental health. And so there, and all of these, these issues, I didn't go into them all, but definitely related to the cardiovascular risk reduction and mental health, particularly related to like chronic stress, two areas that Black women could greatly benefit from, and hopefully you could see a positive impact in their health due to yoga. So that potential there. But what we have found is that there have been some kind of methodological issues with the current studies in the literature. So there's been small sample sizes, the heterogeneity in the population study. There's been no or varying types of control groups. The length of the intervention has varied, so it's hard to see and understand, or hard to see and kind of compare these various studies to each other. And we've, and I guess one of the biggest pieces, other than, that lack of inclusivity of non-white participants, is the inconsistent yoga styles. And so, the studies have included the 3 core principles that I've talked about: the breath, the movement, the meditation, but not very clear. I also showed you a slide that had 20 different types of yoga. So what types of yoga may influence and, health, or what types of yoga may have the largest impact, that's the word I'm looking for, impact on health, and getting a better understanding of how yoga really works to improve health in different populations. And so, you know, there's the methodological issues, but one thing that was kind of clear in the literature of what has already been done is that those shorter, sometimes less intense, right? Thinking about the variety of yoga interventions or yoga that is out there, that they have been successful in lowering stress. And so thinking about motivation and being able to implement that and be successful to engage participants in interventions for a shorter period of time, but still have some level of health impact, that the meditation part is effective. And so, and that yoga itself also can help to increase the self-confidence and self-efficacy, which can serve as a gateway to additional healthy behaviors. I'll talk about that a little bit in the work that I've done related to a pilot study with Black women in yoga I completed. But it's also really clear, I mean, there's lots of pluses and lots of minuses of that more work needs to be done of who benefits most, what types of strategies are most effective, what types of styles are most effective. And so, right, I think that, right, we know this is safe and potentially beneficial treatment, and either, you know, used alone or used to supplement another treatment. And so really focusing on how it can be impactful as a primary treatment. So I don't know if I made that clear. So our previous slide, I had stated how many people, it was a slide saying that many people who started, or it's not uncommon for yoga practitioners to come to yoga based on a recommendation from a healthcare provider. That's the way that some participants, or not participants, some people are brought to yoga, but usually it's not as a primary means of treatment, but as a secondary means of treatment. So I think that is also important for us to be able to examine yoga as a primary means of treating some of the health outcomes that we feel based on some of the preliminary work that it can affect. And so just want to show very briefly, because I realize I'm really running out of time, that the yoga work that has been done in minority communities. So I did a lit search and found that there's been about 8 interventions that have been done, and all of them have been pilot studies. They had, I mean, thinking of some of the methodological points that I brought up earlier about the yoga research in the mainstream community. You see the same thing here, right? All pilot studies ranging in length, so not able to really compare. Individual sessions also ranged, but they were usually about 60 minutes, mainly 1 to 3 times per week. Mixed results for participant retention. And, but, you know, one thing that was very promising from those 8 studies is that there were generally positive results for the yoga group compared to the control group. And I must also say that these interventions are the ones that I included, because there are a couple others out there that focus on minority communities. I included those that had both, the intervention studies that had both the intervention group and a control group. And so this is a table that kind of is a synopsis of the findings of who's been in the studies, the percentage that were minority, and their overall results. And one thing that you'll see that a lot of them were breast cancer, so cancer, heart failure. So I would say, I don't want to use the word sick, but those who have compromised health have been the target of this yoga intervention and or yoga interventions in the past. And so the literature that is out there focusing, the majority of the literature out there focusing on or engaging Black people have really engaged those who have been chronically ill. But I do think that given what we know about yoga from mainstream studies, there is a potential for yoga to be an effective strategy for healthy individuals. So they may have some health issues, or maybe they have high weight or they're sedentary, but thinking that this is a viable strategy for healthy individuals to become healthier, and particularly for Black women to address some of the health outcomes that we commonly report. And so we're going to go through the intervention that I delivered. I developed and delivered to a group of sedentary African-American women in the Twin Cities of Minnesota. And it was called I Heart Yoga. We were focusing on stress, blood pressure, and yoga. And so wanted to investigate the physiological and psychological behavioral effects of this kind of 3-month, 12-week, 3 times per week. So it was pretty intensive for an hour for each session with a delayed intervention group. And so wanted to decrease stress, blood pressure, and physical activity. And then we also conducted post-intervention focus groups with those, the highest attendees versus the lowest attendees, to get some deeper understanding of how we can improve the intervention. And so the sample characteristics, the women, it was like 30-29 in terms of intervention control group, the sample sizes. They were in their 40s, roughly, BMI above 35. So we had, or the mean pretty much above 35. And then with the majority of the women in both groups being classified as obese. And so for the intervention group, they were randomly selected to receive a culturally tailored program. And so they were taught by either Black instructors or instructors that, because I didn't say this, I said the women were sedentary for this study, but they were also overweight. So I targeted overweight women. And so we had curvier instructors to lead the classes, and they were also Black. And so we encouraged to practice 3 times a week in studio, but we also provided online resources because we understood that that sometimes you just can't make it to the studio. And then they also received social support via a private Facebook page. It was some messages that were initiated by the research staff, but participants were also able to post, and it really became a place where they really engaged each other on a regular basis. And then the control group were, they were asked to remain sedentary for those 12 weeks. And then they receive 12 weeks of yoga sessions and online instructional yoga videos after we collected the end of the trial measurements. So it was a delayed intervention type of control group. In terms of perceived stress, we didn't see anything that was statistically significant power was an issue, but it was going in the right direction, that the intervention group had a larger decrease in perceived stress. The blood pressure, we saw that there was, for systolic and diastolic, so systolic, you had a smaller increase in the intervention group, and then actually a decrease in diastolic and blood pressure. But once again, it was not statistically significant. I did report a self-reported physical activity. They weren't very adherent wearing the accelerometers, and so we had to rely on the self-report physical activity, but we did see that the intervention group did increase their physical activity compared to the control, but once again, it was not statistically significant. And then also a greater decrease in sedentary behavior in the intervention group compared to the control. And very similar to with the BMI, and body fat, that the intervention saw greater gains, but once again, not statistically significant. So, I mean, nothing was statistically significant, but it was all going in the right direction. So for me, it was like promising results of developing on a larger scale and wanting to kind of improve the rigor of the methodology to do on a larger and on a larger basis. And so in terms of what we learned from the post-intervention focus groups, right, one participant said, I learned that yoga wasn't difficult and something I could do at home. So kind of dispelling some myths related to yoga and how that it really is accessible to, and keeping in mind that many of these women were in larger bodies, like so accessible, and that they could do it, right? I'm having more confidence in my body, connecting with other women of color, and realizing that exercise does contribute to better health outcomes. So, and then also I found a new practice I could take into my life and use to help not only control my body, but my mind. It also helps me to see that yoga does not have a color, right? Going right back to the stereotypes of yoga. I never really thought of it as an exercise that people of color participating in. That changed tremendously. It opened my eyes to some new things. And so like from the study, what I found like very promising, right? We did include some other cultural values related to collectivism. So, our discussions during the yoga session, which I failed to talk about earlier when presenting, some parts of the yoga intervention, that we were focusing on the group and really relayed that in the sessions and also on our Facebook postings rather than individual. So trying to get into deeper structural Black culture to infuse that into the intervention, and we focus on sharing and expressiveness. We didn't use any music during the yoga class. No instructor used Sanskrit, so they called mountain pose and not Tadasana, and so forth. And then the kind of the spiritual aspects of yoga, or trying to demystify yoga, didn't do any chanting. And we, we discussed at our first meeting before the intervention started about kind of the preconceived notions related to yoga and religious beliefs. So trying to kind of dispel some of those myths, but we did keep like the essential pieces of yoga intact. And so very last, I guess in terms, very last slide of where we're going from it, right? Of thinking about the study on a larger scale being, right, behavior change is really hard. So there's two very key components, like introducing a population that may not traditionally engage in a certain type of activity, yoga, right, Black women in yoga, to a new activity. And so, tackling what may come forth in engaging, Black women in yoga, but then also the larger one of like any behavioral change. I mean, it's so hard trying to change behavior. I mean, probably everyone on this call is engaged in some type of behavioral change work. And so I'm preaching to the choir. And so thinking of how we can use some of the current approaches and address some of the missing pieces that could be related to like diversity and more heterogeneity, and the quality implementation in this, in groups of Black women to be able to hopefully improve health, overall health in this population. So that is it. I am so sorry it took so long. I kind of went off on a tangent in the middle. And so, yes, thank you all. Thank you.
Thank you. We would now like to invite our participants to post questions using the question and answer button in the Zoom webinar interface. We have a couple of questions here. So first we say, the participant said, thank you for this comprehensive overview of the potential for research on yoga as an intervention with Black women, and especially for the methodological guidance. Can you provide a list of key references on yoga that we can circulate to participants?
Yeah, I can, of a combination of some popular lay literature that's out there. Maybe what's best for me to do is to send it out and we can attach it to, well, yeah. So, I have a list,
Awesome.
I don't have in front of me. There's yoga as a peace practice or yoga as a restorative, I'm messing up the title, but Dr. Gail Parker, she actually just published it. It's brand new off the press, and it's targeting minority populations and using how we can use yoga to address trauma and stress in our lives, which is super timely given all that's happening in society continuously with Black and brown bodies. And I have a couple other. I have like the reference from the who I was talking about, the blog with the Christian Yoga for Black Christians. She's written a couple of books that are nice reads. So yeah, I have a couple of resources I can definitely share.
Okay, awesome. We also have another question. One attendee asked, did you examine any attitudes or beliefs related to the alternative health to assess the respondents' predispositions?
I didn't.
Okay. And thinking also of, some of the barriers to exercise, and I know social support or lack thereof is one of the barriers that I've seen, but in your study, did you find that social support, helped with engagement and attendance or retention rather?
Yep, so that was the whole thing. So thinking of social support from a more cultural standpoint of trying to tap into like the collectivism of the wholeness of the group. And so I shift the attention and doing it even more. I have a grant under review. And if I'm able to get funded to do this on a larger scale, it's a huge part of the future trial. Shifting from we tend to look at kind of the social support from our friends and our families, right? But this yoga intervention is really focusing on the social support from the yoga group. So within yoga, you often hear about the community that is created by the breathing, the breath, the connection, moving together, and how powerful that can be. And so trying to tap into that level or that type of social support. And I did have a social support for physical activity in the previous study, and we did see an increase in it. But from the focus groups that I didn't put on the slides, that was probably, one of the better parts of the intervention that the women really could relate to, and that really flourished. I guess that's a better way of saying it, is that the way they connected with each other, and it became a strong sense of community and a strong sense of accountability. And so those who stuck with it, that was one of the reasons why they stuck with it so much. And so that's a very key part of the future trial.
Right. And it's interesting the influence that social support can have. So I'm glad that you're incorporating that, or that's the key interest for the next one. I think that accountability component is really crucial in physical activity in general.
Yep.
I do have another question. Are you finding in the research that yoga is more popular among women of a certain age group?
Actually not. So in the literature, they're pretty targeted. So I guess what I'm finding, so that you have these studies that are targeted, like, breast cancer, or, people's suffering from joint issues. And so they're kind of targeting their population. What I'm finding, like, from when recruiting participants and then having additional kind of focus groups and talking to Black women about yoga, that across the spectrum, there's an interest, and the interest of doing yoga, the why changes, but it is appealing across. So I don't think that so that's one of the positives. So something that's attractive about yoga, that it's very applicable across the age range. So let's say there's someone older who may have mobility issues, or they don't even have to be older, just anyone who has mobility issues, that there are those different types of yoga that all tap into the same 3 tenets. So the breath, the movement, the meditation. And so you can tailor yoga for any age. So no, the short answer is no. Although you found that I don't give short answers.
Yeah, thanks. That's great. I was just thinking, maybe if there was a motivation to, to practice yoga, whether or not that was seen among women of different age groups. And I'm seeing a lot of, like you mentioned, the social media yoga, and so it's becoming more popular, and that's great, especially in engaging in physical activity in some way. And I've noticed that a lot of resources are happening virtually now, with all that's going on related to COVID. And so I think that's great that the access is improving, because a lot of these classes are not available. Have you seen in your research any issues with access to classes for certain types of yoga? I know you mentioned the Afrocentric yoga and all the different kinds, but are you noticing that access and availability is an issue for participants?
Yeah, so like prior to like being in a study, or like reasons why people cite not being engaged in yoga, right? So Afrocentric and Afro flow yoga is becoming popular, but it's not in all places, right? And so the cost continues to be prohibitory for some people. If you go to a more mainstream studio, the type of yoga, you'll tend to have yoga studios that provide a variety of yoga. So if they do, even if they focus on like Ashtanga, or they focus on power yoga, they probably also offer other forms of yoga. So more restorative yoga, to have a broader appeal. And so, getting back to your question, I do think that has been a huge barrier, right? The price, the type of yoga, making sure, right? You can go to the wrong yoga teacher who may not be very well trained, and be asked to do things that could make you feel very uncomfortable, or push you past your physical limits, that could turn you away from yoga like indefinitely. And then also another barrier, sometimes the fact that those spaces, right, depending on where you are, could be very, very wide and not very inviting. Maybe the yoga studio, like they have desires to be inclusive, but it doesn't always translate to those who are practicing the yoga, and what's coming in, and they may not be very inclusive. So you have a teacher who's great, who tries to make you feel inclusive, but everyone else in the space, not so much. And I do say, like, this was popular before COVID-19. I shouldn't say popular. It was prevalent, like available before COVID-19, and may not have been tapped in as much. So YouTube videos, the social media, live streaming that takes place, there's so much all levels. I mean, you can take a yoga class for like 5 minutes of gentle, like everything that you can imagine, the time length that you can imagine that you can find by searching the web. And, you know, that has been, you want to find a silver lining with the COVID-19 is like how people are now relying on kind of media and this live streaming for their activity. And that a lot of people are I think, I shouldn't, it seems to be that people are finding their way to activities that they probably would not have tried before because it's more easily available and out of kind of like curiosity and boredom. You can only do the same thing so being in the house for 3 months. So yes.
Yeah. Okay, so we're going to wrap things up with this last question. One attendee asks, of all the different forms of yoga that are currently practiced, are there ones that have higher risk to injury? If so, what are some of the reported injuries and how can participants reduce their chances of getting injured?
Yep, yeah, oh, definitely. The ones with the most, so it would be the types of yoga that are just more physical, like there's power yoga, flow yoga, Bikram, which is the hot yoga. Some of them, just because of the fact that you see how there are different levels of like with yoga, just like any type of activity, right? There are different levels. Like you have the beginners, you have intermediate, you have those advanced. And like any very simple pose, child's pose, I think many people are familiar with that, right? There's a shape that you're supposed to be in, right? That you think of child's pose, your hips towards your heels. But there are modifications that any person can take so that you can still go into that pose. And so you have some of the more physical types of yoga that are quicker paced, that the instructors or information of how to get into the poses may not be relayed as well. Or you have individuals who may see themselves as physical and thinking that they're able to go into these different poses. And so what you commonly see, joint issues, so with knees, because of the standing poses where your feet are apart and your knee is supposed to be over your ankle, you have the pressure of going, the knee extending beyond the toes, or it's just not in proper alignment. So one thing that's, you know, a good yoga instructor does is about alignment before depth, right? And a lot of people go for depth before alignment. And so you see shoulder injuries a lot. So yeah, so knee, joint issues, shoulder injuries. And it's really, it's really, I mean, so one of the pluses I see with like having like a structured research setting and, you know, engaging a population with yoga is being able to take the time to start at the very beginning and to build upon the practice, right? So you, an ordinary person may just say, oh, I want to go to yoga, and you step into a yoga class, and it may even be, you know, labeled as a beginner yoga class, but they may not break down poses as much, or may not give as much direction, right, that you really need. And so anytime you have those types of situations, there's always that space of being able to injure yourself. But not to sound redundant, it's the joints, the knees, the shoulders. You see hip issues sometimes because people try to go into opening up their hips too quickly. Hamstrings, so thinking about the muscles, straining muscles for trying to go too deep in a flexibility pose. So you have to be careful. You got to protect your body, but if you listen to your body and don't push your body past what it says it wants to go, you can avoid injury. I've never been injured with my yoga. Oh, no, that's not true. I pulled my hamstring. That is right, because I went too far. Yeah, I forgot. I pulled my hamstring. Yeah, I forgot about that in a Bikram yoga class where it was a heated class. And so then you get the false sense of flexibility. And my hamstring was not as flexible as I was feeling that it was. And yeah, so you have to be careful. But anyone can do it. There's chair yoga. If you can't stand, there's yoga classes where you lay on your back the entire time or you're seated the entire time on the floor.
Yes, I've actually seen a chair yoga class in an elderly population at a library, and I feel like that was just one of the ways to show that it is for everyone, you know, no matter the ability or range of motion, everybody's able to participate.
Yeah.
And so I do want to thank you, Dr. Barr-Anderson, first for the yoga demonstration in the beginning. You know, a lot of times we don't even realize the tension we carry in our shoulders, so that was an awesome starting point. And also thank you for this enlightening presentation on the potential of yoga to impact the health outcomes of Black women. On behalf of the Council on Black Health and the Solution to Diabetes in Black Americans Core, I would also like to thank our attendees for participating in today's webinar. We will share an evaluation survey and video of this webinar shortly. Also, please look out for an invitation to our next webinar on Wednesday, June 24th, entitled Teacher-Led Physical Activity Intervention in Low-Income Preschool-Age Children, Lessons Learned, which will be presented by Dr. Al-Hassan. Thank you, everyone, and have a wonderful afternoon.